Presentation will be on trauma-informed care and how it should be implemented in the workplace. In order to understand what trauma-informed care is and why it's important, we first have to understand what trauma is. So what is trauma? Trauma refers to intense and overwhelming experience that involves serious loss, threat or harm to a person's physical and/or emotional well-being. These experiences may occur at any time in a person's life. They may involve a single traumatic event or may be repeated over many years. These trauma experiences often overwhelm the person's coping resources. This often leads to the person to find a way of coping that may work in the short run but may cause serious harm in the long run. To help you understand what examples of traumatic events are, there's going to be a few listed on this slide. Some of them can include, but not limited to, rape, serious medical illness or disease, which can be disabling conditions, loss of function, invasive and distressing procedures, physical, emotional, and/or sexual abuse in childhood or adulthood. In childhood, this could include neglect or abandonment, which would include food insufficiency, lack of money to meet basic needs, homelessness, death of a parent, divorce, or a family life that includes drug addiction, alcoholism, parental incarceration, or violence. Additional examples of traumatic events can include, but are not limited to, war, combat and civil unrest conditions, including torture affecting soldiers and refugee civilians, catastrophic losses of one's home, livelihood, people, pets due to flood, tornado, hurricane, or other disasters of nature, involvement in or witnessing horrific events involving violence, gruesome accidents, or death and serious injury. There are many different impacts of trauma over a lifespan, and how that can affect an individual is very different from person to person. Some of the impacts of trauma over a lifespan are neurological, biological, psychological, and social. These can include changes in brain neurobiology, social, emotional, and cognitive impairment, potential adoption of health risk behaviors as coping mechanisms. These could include eating disorders, smoking, substance abuse, self-harm, sexual promiscuity, and violence. Additionally, there could be severe and persistent behavioral health, health and social problems, or early death. Slide is to show the effects on the brain. There's a healthy brain and an abused brain on this photo to show the effects of trauma. So on the left is your healthy brain. And if you look down in the bottom right-hand corner of this slide, it has a little key showing that red is the most active to blue and black being the least active. And so in this PET scan on the left is the brain of a normal child, which shows the regions of high and low activity. At birth, only primitive structures such as the brainstem are fully functional. In regions like the temporal lobes, early childhood experiences wire the circuits. Now on the right here is an abused brain. And just by looking at this slide, you can see that there's quite a difference between the two brains. And this PET scan is the brain of a Romanian orphan who was institutionalized shortly after birth. It shows the effect of extreme deprivation in infancy. The temporal lobes, which regulate emotions and receive input from the senses, are showing to be very not active. So if you look down on that key again in the bottom right, which looks quite different from the healthy brain on the left. And such children that show this in their PET scans suffer emotional and cognitive problems. Multiple trauma experiences also raise the risk for anxiety problems and fears, which can include avoiding people, places, and things that are similar to or are reminders of the traumatic event. Can also raise the risk for physical health problems, sleep problems, emotional problems such as feeling numb and or disconnected from oneself or environment, memory problems, flashbacks. It also raises the risk for alcoholism and alcohol abuse, substance use and abuse, obesity, respiratory difficulties, heart disease. It raises the risk for multiple sexual partners, poor relationships with others, smoking, suicidal attempts, and unintended pregnancies. There are a lot of different findings on trauma and data that correlates what trauma can do to a person and their emotional well-being. A few of these stats have been added to this page, but there's a lot more as well. So some of the findings on trauma here are 1 in 6 men have experienced emotional trauma. 80% of people in psychiatric hospitals have experienced physical or sexual abuse. 66% of people in substance abuse treatment report childhood abuse or neglect. And 90% of women with alcoholism were sexually abused or suffered severe violence from parents. So these findings help to show some negative coping behaviors that people can have from trauma, as well as life events that can occur due to trauma. So these things are always really important to take into consideration when working with clients. Additional findings on trauma include that 2/3, or 67%, of all suicidal attempts are attributed to childhood adverse experiences. 64% of adult suicide attempts are attributed to childhood adverse experiences, and 80% of child and adolescent suicide attempts are attributed to childhood adverse experiences. So what does the prevalence of this data show? It shows that the majority of adults and children in psychiatric treatment settings have trauma histories. It also shows that a sizable percentage of people with substance use disorders have traumatic stress symptoms that interfere with achieving or maintaining sobriety. It also shows a sizable percentage of adults and children in the prison or juvenile justice system have trauma histories. The prevalence of this data also shows that there is a growing body of research on the relationship between victimization and later offending. Additionally, it shows that many people with trauma histories have overlapping problems with mental health, addictions, physical health, and are victims or perpetrators of crime. Overall, it shows that victims of trauma are found across all systems of care. When working with clients, let's say you're working with a client at the CCC, it may not be particularly evident in your first encounter with a person that they've experienced trauma, or perhaps they're not exhibiting signs of having mental health history. However, it's very important to take this into consideration when working with clients. The point of this presentation is to show that the experience of trauma in childhood and adulthood matters. An equality healthcare and human service and social safety net organization is designed to address the impact of trauma for every single person in that organization, staff included. We, along with most healthcare and human service systems, do not routinely and comprehensively inquire about the trauma that may have been or is currently experienced by our clients. We can make mistakes when we don't fully understand the role that trauma may play in the problems and disappointments of our clients. It is our responsibility to help. What actions can our organization take? It would be wise to assume that trauma may play a role in the person's current life difficulties, and that is our job to engage the person in exploring his or her life history related to trauma in a way that is respectful and sensitive. It's also our job to ensure that our policies, procedures, activities, environment, and ways that we relate and talk to each other creates a safe and trusting environment. When working with clients, it's important to just assume that this client has been through trauma. And truthfully, it should be applied to other volunteers and employees as well. If you approach a person with the perspective that perhaps they're reacting in a certain way due to trauma, it will help to better understand that person and why they do what they do. Why is trauma-informed care important to the work that we do at the CCC? Well, to provide effective services, we need to understand the life situations that may be contributing to the person's current problems. There are many current problems faced by the people we serve that may be related to traumatic life experiences. People who have experienced traumatic life events are often very sensitive to situations that remind them of the people, the places, or the things involved in their traumatic event. These reminders, also known as triggers, may cause a person to relive the trauma and view our organization as a source of distress and not as a healing and welcoming environment. Additionally, trauma-informed care is important to the work that we do at the CCC because we might unintentionally cause harm by practices, policies, and activities that are insensitive to the needs of our clients. Re-victimizing or re-traumatizing someone unintentionally is a real possibility. All of us who work or volunteer at the CCC are not immune from adverse experiences in the present or the past. Understanding trauma also means recognizing that our personal traumatic experiences or the stress associated with working in human services may impact our emotional and physical well-being, as well as our work success and satisfaction. The last thing that any of us want to do is to unintentionally cause our clients to relive their trauma. That's why it is so important to have strong relationships. And what can hurt these relationships? Well, interactions that are humiliating, that are harsh, impersonal, disrespectful, critical, demanding, or judgmental. Lots of things can help these relationships to build and be healthy. These interactions are ones that express kindness, patience, reassurance, calm and acceptance, and listening. Frequenting the use of words like please and thank you help people to feel respected and that they will get that respect back. We can also unintentionally cause our clients to relive their trauma if we don't show the importance of the physical environment. And what can hurt this? Congested areas that are noisy, poor signage that is confusing, uncomfortable furniture, cold or non-inviting colors in paintings or posters on the wall. And what can help? What can help this physical environment to help our clients not be re-traumatized? Could be treatment and waiting rooms that are comfortable, calming, and offer privacy. Furniture is clean and comfortable. There's a no wrong door philosophy. So basically, we're all here to help. You can go to any one of us and we'll direct you in the right way. Wall coverings, posters, and pictures are pleasant and convey a hopeful and positive message. Now, one example of how to show the importance of the physical environment is, let's say we're working with a veteran, and that's all the information we know, but we know that they're a veteran. So this could mean that they've been in a combat zone or they have not. However, let's say we're going to meet with this veteran one-on-one in a conference room. Now, one thing we could do to have trauma-informed care would to be walk into that room and let that client sit where they would like to sit, instead of forcing them to sit in a specific seat that we've decided they need to sit in. Because sometimes with PTSD, sitting with your back towards a door can result in anxiousness. You can be scared and frustrated and nervous. And immediately that client is going to be on guard for whatever we need to talk to them about in that interview. So this small gesture of letting this client sit where they want to sit so that they feel comfortable and safe in the room is a huge gesture to follow trauma-informed care and help our client. We can potentially cause our clients to relive their trauma if we do not have a focus on the importance of our policies and procedures. So there's things that can hurt. So these things could include rules that always seem to be broken. If your organization has these types of rules, maybe you should take a second look at them. Policies and procedures that focus on organizational needs rather than on client needs. Documentation with minimal involvement of clients, as that will lead to bias. Many hoops to go through before a client's needs are met. This isn't following the always the door open policy. And language barriers. If we don't provide materials that reach out to other people's languages or have anyone else on staff or any way to translate, this can also hurt. And what helps? Sensible and fair rules that are clearly explained. So focus more on what you can do rather than what you can't do. Transparency and documentation and service planning. Materials and communication in the person's language, and continually seeking feedback from clients about their experience in the program. We can unintentionally cause our clients to relive their trauma if we don't have a focus on the importance of our attitudes and beliefs. So what can hurt? So asking questions that convey the idea that there is something wrong with the person, and regarding a person's difficulties only as symptoms of a mental health, substance use, or medical problem. And what helps? So asking questions for the purpose of understanding what harmful events may contribute to current problems, and recognizing that mental health, substance use, and physical health symptoms may be a person's way of coping with their trauma. We've spent a lot of time talking about what trauma is and what trauma can do, but what is trauma-informed care? So trauma-informed care, or a trauma-informed approach, is often referred in the acronym TIC. It is a promising model for organizational change in health, behavioral, and other settings that promote resilience in staff and patients. Key principles of this approach include organizational safety, trustworthiness, transparency, cultural sensitivity, collaboration, and empowerment among and between staff and patients. This approach recognizes the role that trauma plays in the lives of patients and consumers and seeks to shift the clinical perspective from what's wrong with you to what happened to you by recognizing and accepting symptoms and difficult behaviors as strategies developed to cope with childhood trauma. When doing trauma-informed care, it's important to know the 4 R's. The first is realize. Realize the widespread impact of trauma and understand potential paths for recovery. Recognize. Recognize the signs and symptoms of trauma in clients, families, staff, and others involved with the system. Respond. Respond by fully integrating knowledge about trauma into policies, procedures, and practices. And resist re-traumatization. Resist re-traumatization of children as well as the adults who care for them. To dig a little deeper into the 4 R's, we'll talk about what realize means. So realize means realizing the widespread nature of childhood trauma and how it impacts the child's emotional, social, behavioral, cognitive, brain, and physical development, as well as their mental health. In addition, Adults must be aware of the influence of trauma on family members, first responders, service providers, and others who experience secondary stress. In some instances, adults endure the same traumatic events or circumstances as the child and may benefit from similar supports. Recognize. Recognizing the symptoms of trauma, including how trauma reactions vary by gender, age, type of trauma, or setting. In addition, the adults in children's lives must understand that a child's challenging behaviors are normal, self-protective, and adaptive reactions to highly stressful situations rather than viewing that child as intentionally misbehaving. Children's trauma reactions are understood to be adaptive efforts to protect themselves in response to traumatic events. For example, a child may be hypervigilant to an adult's anger or disapproval because in the past he or she experienced physical abuse by a parent. Or a child may disassociate or daydream as a learned response that enables them to avoid feeling or thinking about a traumatic experience. In addition, trauma-informed care means recognizing that trauma may influence a child's engagement in activities and services, interactions with peers and adults, and responsiveness to rules and guidelines. Now, this slide does talk about children's challenging behaviors, but it also can be applied to adults. Respond. Respond by making necessary adjustments in their own language and behavior to the child's environment and to policies, procedures, and practices to support the child's recovery and resilience to trauma. And again, this respond piece talks about children, but it completely applies to adults and any clients that you'll encounter. And lastly, the fourth R, resisting re-traumatization. Now we can resist re-traumatization by actively shaping children's environments to avoid triggers and protect children from further trauma, which can exacerbate the negative impacts of trauma and interfere with the healing process. Again, this can be applied to working with adults and helping to shape that physical environment to not re-traumatize. This was briefly touched on earlier in the presentation, but there are 6 key principles of a trauma-informed approach. A trauma-informed approach reflects adherence to 6 key principles rather than a prescribed set of practices or procedures. These principles may be generalizable across multiple types of settings, although terminology and application may be setting or sector specific. So these 6 principles include safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, and cultural, historic, and gender issues. These are all important principles to take into consideration when having a trauma-informed approach. A quick example of trauma-informed care and questions under the what not to do. So instead of asking, why is this so difficult for you? Instead, rephrase your question to say, is there anything in your history that makes seeing a practitioner or having a physical examination difficult? Instead of saying, you don't seem comfortable, you could say, is there anything I can do to make your visit and exam easier? Now, whether or not you work in a healthcare setting, these specific questions may not be applicable, but the general guideline of how to phrase your question is. So we will now be moving on to case studies. So there's going to be 3 different case studies, and there's multiple choice answers at the end. The case study is going to describe a situation in a person and give you multiple different options of what you feel the best response would be in a trauma-informed way. Case scenario number 1. Molly, who is 21, experienced sex trafficking at the age of 19 and has a prostitution charge on her record. She is working with an attorney to get the charge expunged so that she can apply for jobs. Molly disclosed her story to the attorney and used the word boyfriend to describe her trafficker. How should the attorney respond? A. If he was your boyfriend and cared for you, he would not exploit you. B. When you say boyfriend, you mean trafficker? C. Sounds like he is not someone to be in a relationship with. And D. Tell me about your experience with your boyfriend. The most trauma-informed response was D. As the most trauma-informed response, answer D allows Molly to disclose what she wants from her story. It mirrors Molly's language of boyfriend to demonstrate that the attorney respects her perspective and exemplifies that the attorney is interested in better understanding the situation through Molly's own lens. Case scenario number 2. Zoe, 25, escaped her experience of trafficking and comes to her primary care doctor for follow-up appointments related to past injuries. She has used substances after enduring physical abuse. Zoe wants her physical pain to go away and asks the doctor to write a prescription. How should the medical provider respond? A. Considering your history of substance abuse, you might become addicted again. B. I think you need to try other alternatives. C. Based on my medical experience, this would be a bad idea. Or D. It seems like you need something to help your pain. In the past, it sounds like you used substances to help you survive the pain. Is that what you are looking for now? The most trauma-informed response is D. Answer D tries to get to the heart of what Zoe is asking for and highlights in a survivor-centered lens why she may have used it in the first place. The doctor asks for confirmation of Zoe's needs and allows Zoe to answer on behalf of herself. Case scenario number 3. Norman, 43, is receiving counseling service from a local mental health clinic. He is currently working with an immigration attorney and is in the process of applying for his T visa. When his counselor expresses wanting to work through his trauma, Norman discloses that he was not physically restrained, but his documents were withheld. How should the counselor respond? A. Why didn't you just leave? B. You didn't go through physical abuse, which is good. C. It seems like you went through a lot of trauma when you were there. How are you processing through it? And D. I think we can get through hard times. I'm sorry. The most trauma-informed response is C, and here's why. Answer C acknowledges that what Norman faced was very difficult. It leaves out any assumptions and allows Norman to speak on his own story and the emotions he experienced. It allows him to process his trauma in his own language and to steer the counseling session in the direction that he wants. If you can tell, between the 3 case scenarios, the answers that were the most trauma-informed allow the clients to advocate for themselves. This is a huge piece of trauma-informed care. After reading over those case scenarios, you may be thinking that some of those answers sounded pretty similar, and it may be hard trying to figure out how to find the words to communicate that you're trying to be trauma-informed and let the client advocate for themselves, which is totally understandable, especially in the beginning stages of using trauma-informed care. I really like this passage that says, because language is complex, multidimensional, and bound by culture, time, and place. Trauma-informed care is a practice that takes effort to understand and apply. We may not always say the right thing, or it may come out differently than intended, but understanding that our language has impact is the first step in working toward a more trauma-informed practice. Most importantly, working within a trauma-informed philosophy and putting it into practice in our day-to-day work is imperative to the healing process for survivors. So this is the end on trauma-informed care and how to implement it in the workplace or in your volunteer opportunity. Trauma-informed care is all about helping the client feel safe, feel grounded, and helping them find resources.